8 exercises you will regret ignoring before it is too late. Before we get started, please leave a comment below with your name and the city you are watching from. We would love to know. I am Dr. Sofia, and for almost 15 years I have worked in clinical practice with men and women whose bodies had already started betraying them, long before they ever decided to walk into my office. The list I am about to share with you is built directly from what I see week after week in that room. These are movements that cost almost no time, ask for no equipment in the majority of cases, and quietly protect you for decades if you simply start them now and refuse to put them off any longer. Exercise number 1, calf raises. The reason this movement sits at the top of my list is that very few people think about their calves at all, until they reach an age in which they suddenly realize they can no longer push themselves up onto their toes with confidence. Falling is one of the leading causes of serious injury-related complications in older adults, and the ability to generate force through the calf complex is one of the most overlooked protective factors against that very risk. A study published in geriatric research journals showed that older adults who performed regular calf strengthening exercises had a significantly lower incidence of balance loss during walking, compared to those who neglected this muscle group entirely. I have noticed in my own practice that the patients who train their calves consistently for the smallest amount of time each day tend to be the ones who keep their independence the longest, which is something that is often underestimated when we focus only on visible muscle size. This exercise intensely works the gastrocnemius, the soleus, and the posterior tibial muscles, all of which play a fundamental role in maintaining the stability of the ankle and the knee during every single step we take from the moment we wake up until the moment we go to sleep. To perform it correctly, stand up straight with your feet hip-width apart and slowly rise onto the balls of your feet, lifting your heels as high as your ankle mobility allows. Hold the peak position for a full moment, feeling the contraction throughout the calf, then return the heels down to the floor with full control and without simply dropping. An extra tip to maximize results is to perform the movement on the edge of a step or any slightly elevated surface so that your heel can drop below the level of your toes during the descent, which significantly increases the stretch and therefore the strength gain over time. A common mistake is performing the movement too quickly and skipping the lowering phase, which removes much of the benefit of the exercise and turns it into a small bounce rather than a real muscular challenge. Another mistake I see many people make is locking the knees completely, which transfers unnecessary pressure to the joint and reduces the actual muscular tension on the calf. For beginners, it is recommended to start with 2 to 3 sets of 12 to 15 repetitions, gradually increasing the load by holding dumbbells as conditioning improves. For more advanced practitioners, 3 sets of 20 to 25 repetitions with controlled tempo are usually enough for a good stimulus. Contraindications: people with recent Achilles tendon injuries, recent ankle sprains, or chronic calf pain should avoid loaded versions of this exercise and seek professional guidance before returning to it. As a gentler alternative for those just starting out, performing the movement barefoot on the floor without any added weight is more than enough to begin building the foundation of strength and control needed to progress safely. Exercise number 2, face pulls. If there is a single movement capable of reversing the rounded shoulder posture that modern life forces on almost everyone, it is this one. Years spent looking at phones and laptops pull the shoulders forward, tighten the chest, and weaken the rear deltoids, which over time creates shoulder impingement, chronic neck pain, and a head that sits forward of the spine instead of balanced above it. Regular practitioners report a visible improvement in posture within weeks, and a significant reduction in tension-type headaches that come from overuse of the upper trapezius muscles. This exercise intensely works the rear deltoids, the rhomboids, the middle trapezius, and the external rotator muscles of the rotator cuff, functioning almost like a reset button for shoulder positioning that we can perform in just a few minutes a day. To perform it correctly, attach a resistance band to a fixed point slightly above head height and step back far enough to create tension in the band. Grasp the ends of the band with both hands and pull it directly toward your face, separating your hands as you pull so that they finish near your ears with the elbows remaining high throughout the entire movement. Slowly return to the starting position with full control and without letting the band snap you forward. An extra tip to maximize results is to imagine you are pulling the band apart rather than just pulling it back, which dramatically increases the recruitment of the rear deltoids and the muscles between the shoulder blades. A common mistake is using the arms to pull the band to the face instead of using the back of the shoulders, which often happens when the resistance is too heavy or the movement is performed with too much speed. Another mistake I see many people make is dropping the elbows during the return phase, which removes much of the tension from the rear deltoids and turns the exercise into a simple arm movement. The elbows should remain slightly higher than the wrists throughout the entire path of the movement. For beginners, 3 sets of 12 to 15 repetitions are usually enough to start. For more advanced practitioners, 15 to 20 repetitions using progressively thicker bands are usually enough for a good stimulus. Contraindications: people with active rotator cuff tears, recent shoulder dislocations, or severe impingement should seek professional guidance before performing this exercise. As an accessible alternative for those who do not have a resistance band at home, simply face down on the floor and lifting the arms outward in a reverse fly motion provides a very similar stimulus and is an excellent starting point for the same group of muscles. Exercise number 3, wall sit. Think of the wall sit as a savings account for your ability to stand up from a chair unassisted decades from now. The quadriceps are the most powerful muscles in the body, and like any high-output muscle group, they lose size and strength at a rate that surprises almost everyone after the age of 50. Regular practitioners report noticeable improvement in their ability to climb stairs, get out of bed without using their hands, and rise from low chairs without depending on arm support. A study in physical rehabilitation literature showed that older adults who trained isometric leg strength at least twice per week retained their independence in daily activities for a significantly longer period than those who did not include this kind of work in their routine. I have noticed that even patients who are very deconditioned tend to respond well to this exercise because it does not require any equipment and can be done next to any wall in any room of their house. This exercise intensely works the quadriceps, the gluteus medius, and the deep stabilizing muscles of the knee joint, all of which collaborate to keep the knee aligned during weight-bearing activity throughout the day. To perform it correctly, stand with your back flat against a wall and slide your feet forward about 2 steps. Then lower your hips until your knees are bent at approximately 90 degrees, and your thighs are parallel to the floor. The lower back should remain pressed to the wall, and the knees should be aligned directly above the ankles, not extending beyond the toes. Hold this position for the prescribed duration while breathing slowly and steadily. An extra tip to maximize results is to actively press the lower back into the wall throughout the entire hold, which recruits the deep core muscles and protects the lumbar spine from overload during the sustained effort. A common mistake is placing the feet too far forward, which reduces the angle at the knee, and therefore the demand on the quadriceps during the hold. Another mistake I see many people make is sliding one leg further than the other, which creates a muscular imbalance that develops silently over time. Both feet should be at the same distance from the wall, and the weight should be evenly distributed between them at all times. For beginners, holds of 20 to 30 seconds in 2 sets are usually enough to start. For more advanced practitioners, holds of 60 to 90 seconds in 3 sets are usually enough for a good stimulus. Contraindications: people with severe knee osteoarthritis, recent knee surgery, or significant patellar pain should avoid this exercise or reduce the angle considerably, since prolonged isometric load on a compromised joint may aggravate inflammation and prolong discomfort. An accessible alternative for those who cannot yet reach a proper depth is to slide only halfway down the wall, holding the position with reduced knee angle, and gradually progressing each week as tolerance and strength improve together. Exercise number 4, bird dog. What most people do not realize is that lower back pain in adults is rarely caused by something structural in the spine and is much more commonly caused by a loss of coordination between the muscles that stabilize the trunk. The bird dog addresses exactly that problem, restoring the brain-to-core connection that tends to disappear with years of sedentary behavior and slow weakening of the deep stabilizers. This exercise intensely works the deep spinal stabilizers, the multifidus, the gluteus maximus of the supporting leg, and the scapular stabilizers of the supporting arm, functioning as a kind of full-body recalibration in a low-impact position that can be done in just a few minutes at the start of any session. To perform it correctly, start on all fours with your hands under your shoulders and your knees under your hips, maintaining a neutral spine without arching the lower back and without rounding the upper back. From this position, slowly extend your right arm forward while simultaneously extending your left leg backward, keeping both at the same height as your torso and avoiding any swing as you move. Hold this extended position for a few seconds and return to the starting point. Then repeat on the opposite side. An extra tip to maximize results is to imagine you are balancing a glass of water on your lower back throughout the entire movement, which prevents any rotation or swing and forces the deep stabilizers to do the work, not the superficial muscles that usually take over under fatigue. A common mistake is letting the lower back arch as the leg extends behind you, which shifts the load from the core to the lumbar spine and removes much of the benefit of the exercise. Another mistake I see many people make is reaching the arm too high, which pulls the upper trapezius into excessive tension and causes the shoulders to rise toward the ears. The arm should remain aligned with the trunk, not aimed at the ceiling or extended above the head. For beginners, 2 to 3 sets of 6 to 8 repetitions per side are usually enough to begin. For more advanced practitioners, 3 sets of 10 to 12 repetitions per side using slow tempo and brief pauses at extension are usually enough for a good stimulus. Contraindications: people with acute herniated disc pain, severe osteoporosis, or recent abdominal surgery should seek professional guidance before performing this movement, since any spinal flexion or extension under load can aggravate certain conditions. As a gentler alternative for those who have difficulty maintaining stability throughout the full extension, simply lifting only the arm or only the leg at a time instead of both together, reduces the demand on the trunk and allows the practitioner to master the coordination gradually before progressing to the full movement. Exercise number 5, side plank. Spinal asymmetry is one of the most common contributors to chronic back pain in adults over 40, and most people never address it because they cannot see it developing in the mirror and never feel it until the discomfort becomes constant. The side plank is one of the most efficient ways to challenge the lateral chain of the body, which is often the weakest link in people who sit for long hours and develop scoliosis-like patterns over time without realizing it. A study published in spine rehabilitation journals found that lateral stabilization exercises like this one help significantly reduce episodes of recurrent back pain in practitioners who include them consistently over a period of months. This exercise intensely works the obliques, the quadratus lumborum, the gluteus medius, and the entire lateral stabilizer system of the trunk, functioning as a protective brace for the spine during rotation-based activities like reaching across the body, picking up objects, or turning to look behind. To perform it correctly, lie on your side with your elbow directly beneath your shoulder and your legs extended in a straight line. Lift your hips off the floor so that your body forms a diagonal from head to feet, with the supporting shoulder, hip, and ankle stacked on top of one another. Hold this position for the prescribed duration while breathing calmly through the nose. An extra tip to maximize results is to actively push the floor away with the supporting elbow, which engages the serratus anterior and prevents the supporting shoulder from collapsing forward under the load over time. A common mistake I see many people make is letting the hips drop toward the floor during the hold, which removes tension from the obliques and turns the exercise into a passive rest position rather than an active muscular challenge. Another mistake is sinking into the supporting shoulder, which builds unnecessary pressure on the joint over time and can lead to irritation in the rotator cuff if repeated too often. The shoulder should remain stable and aligned directly above the elbow at all times. For beginners, holds of 15 to 20 seconds per side in 2 sets are usually enough to start. For more advanced practitioners, holds of 45 to 60 seconds per side in 3 sets are usually enough for a good stimulus. Contraindications: people with shoulder injuries such as recent rotator cuff tears or acute impingement should avoid this exercise or perform it on a bent knee variation that reduces the load on the supporting arm. As a gentler alternative, performing the same lateral hold with the knees bent and the lower legs resting on the floor reduces the load on both the obliques and the shoulders significantly while still providing most of the stabilization benefit for the spine. Exercise number 6, single leg Romanian deadlift. Most balance problems in older adults do not actually come from weak ankles at all. They come from a lack of strength in the posterior chain and from poor hip stability during single leg movement. This exercise directly addresses both problems and functions as preventive medicine for the lower back and the hips throughout the rest of life. Regular practitioners report a noticeable improvement in their ability to step over curbs, avoid stumbles on uneven surfaces, and perform everyday tasks that require standing on one foot for more than a moment. This exercise intensely works the hamstrings, the gluteus maximus, the erector spinae of the lower back, and the deep stabilizers of the standing ankle. functioning as a complete posterior chain challenge in a single movement that demands both strength and control at the same time. To perform it correctly, stand on one leg with the knee slightly bent and the opposite leg extended behind you in line with the body. Keeping the back straight and absolutely flat throughout the entire path, hinge forward at the hips, lowering the torso and the lifted leg together until both are nearly parallel to the floor. Then drive through the standing heel to return to the starting position without using momentum. An extra tip to maximize results is to keep the standing knee slightly bent throughout the entire movement rather than locked, which protects the joint and keeps the hamstrings engaged throughout the full range of motion. A common mistake I see many people make is rounding the upper back during the descent, which loads the lumbar spine and turns the exercise into a mobility gesture rather than a strength exercise. Another mistake is to look down at the floor during the forward hinge, which curves the neck and builds tension throughout the entire spine. Keep your gaze fixed slightly forward of your feet and imagine a straight line extending from your head all the way through your lifted heel at all times. For beginners, 3 sets of 6 to 8 repetitions per leg are usually enough to begin. For more advanced practitioners, 3 sets of 10 to 12 repetitions per leg holding dumbbells of moderate load are usually enough for a good stimulus. Contraindications: people with acute lower back pain, active disc herniation, or significant balance impairment should avoid this exercise and seek professional guidance before practicing it. As an accessible alternative for those who cannot yet master the balance demand, performing the same movement with one hand resting against a wall provides significant stabilization, allowing the practitioner to focus on the hip hinge pattern before progressing to unsupported execution over the coming weeks. Exercise number 7, banded pull-apart. The upper back is one of the most neglected regions in modern training, and that is a serious mistake considering how much tension accumulates there throughout the day for almost every adult reading this. The banded pull-apart is a small movement with a very large preventive effect, especially for people who spend long hours in front of screens and feel that familiar tightness building between the shoulder blades by the end of the afternoon. Regular practitioners report noticeable relief in neck and upper back tension within the first few weeks, along with significantly better posture during daily activities. This exercise intensely works the rear deltoids, the rhomboids, the middle and lower trapezius, and the rotator cuff muscles responsible for external rotation of the arm, all of which collaborate to keep the shoulder blades retracted and properly positioned throughout the day. To perform it correctly, hold a resistance band in front of you with both hands at arm's length, the band slightly taut and your arms extended at shoulder height. Keeping the arms straight, pull the band apart by squeezing the shoulder blades together, bringing your hands as far outward as the band allows. Then slowly return to the starting position with full control and without letting the shoulders collapse forward. An extra tip to maximize results is to imagine you are trying to pinch a pencil between the shoulder blades at the end of the pull, which dramatically increases the recruitment of the mid-back muscles and ensures the movement is being driven by the right area rather than by the arms. A common mistake is bending the elbows during the pull, which shifts the tension from the back to the arms and significantly reduces the benefit. Another mistake I see many people make is using a band that is too heavy, which forces them to recruit the upper trapezius instead of the mid-back muscles and builds unnecessary tension in the neck over time. The proper band should allow between 12 and 15 repetitions with full control and proper form. For beginners, 2 to 3 sets of 10 to 12 repetitions are usually enough. For more advanced practitioners, 3 sets of 15 to 20 repetitions using progressively stiffer bands are usually enough for a good stimulus. Contraindications: people with shoulder injuries such as recent dislocations or active impingement should avoid this exercise or reduce the resistance to a very light band, since high tension across the joint can aggravate certain conditions over time. As an accessible alternative for those without any resistance band, lying face down on the floor with the arms extended to the sides and lifting them off the floor in small arcs can produce a very similar stimulus using only body weight and a few minutes of focused effort. Exercise number 8, Cossack squat. Mobility in the hips is one of those things that once lost, becomes extremely difficult to recover, and yet most people wait until the stiffness becomes painful before deciding to do anything about it. The Cossack squat is one of the most efficient movements available for maintaining and even restoring this lost mobility, particularly in the hips and ankles, which tend to tighten with years of inactivity and slowly punish us during the simplest of daily tasks. Regular practitioners report a significant improvement in their ability to perform everyday movements like getting out of a car, picking objects up from the floor, and rotating the trunk to look behind them. This exercise intensely works the quadriceps, the gluteus maximus of the supporting leg, the adductors, the hip external rotators, and the ankle stabilizers, all coordinated through a wide range of motion that no other common movement trains as thoroughly. To perform it correctly, stand with your feet significantly wider than shoulder width apart, and the toes turned slightly outward. Shift your weight to one side, bending that knee deeply while keeping the opposite leg fully extended and the foot flat on the floor. Lower your hips until the bent knee is tracking over the toes and the torso is slightly forward. Return to the starting position by pushing through the heel, then repeat on the other side with the same level of control. An extra tip to maximize results is to keep the heel of the extended leg pressed firmly into the floor throughout the entire movement, which protects the medial knee and significantly improves the demand on the hip of the bent side. A common mistake I see many people make is letting the heel of the bent leg rise off the floor during the descent, which reduces the ankle demand and shortens the range of motion unnecessarily. Another mistake is collapsing the chest forward and rounding the upper back, which removes length from the spine and places unwanted load on the lumbar region. The torso should remain relatively upright throughout the descent and the ascent. For beginners, 2 to 3 sets of 5 to 8 repetitions per side are usually enough to start. For more advanced practitioners, 3 sets of 10 to 12 repetitions per side holding a kettlebell at the chest are usually enough for a good stimulus. Contraindications: people with recent hip replacement, significant knee ligament injury, or acute groin pain should avoid this exercise or reduce the depth considerably until professional guidance is obtained. As a gentler alternative, performing the same lateral movement, holding onto a sturdy object for balance and limiting the descent to a comfortable angle, provides most of the mobility benefit while significantly reducing the risk of strain for those who are just beginning to rebuild this kind of joint freedom. Now that you know the 8 main movements, we still have a special bonus for you. Bonus exercise: diaphragmatic breathing. If there is one practice that I believe most adults should adopt immediately and yet almost no one ever thinks about, it is this one. Even a few minutes of slow, deep belly breathing practiced daily can produce measurable reductions in resting blood pressure, in resting heart rate, and in systemic anxiety markers that most of us carry without even realizing it. A study published in cardiovascular health journals found that individuals who practiced slow diaphragmatic breathing for as little as 10 minutes a day showed significant improvements in autonomic nervous system balance within just a few weeks of consistent practice, something I have observed repeatedly in my own patients whose stress levels tend to drop noticeably within the first month. This practice gently works the diaphragm, the intercostals, and the deep muscles of the pelvic floor, functioning as a kind of internal reset for the entire nervous system in a position that anyone can adopt within seconds. To perform it correctly, lie on your back or sit upright with the spine lengthened and the shoulders relaxed. Place one hand on the chest and the other on the belly. Inhale slowly through the nose for a count of 4, allowing the belly to expand while the chest remains mostly still. Exhale gently through the mouth for a count of 6 to 8, feeling the belly draw back toward the spine as the air leaves the body. Repeat this cycle for the prescribed duration. An extra tip to maximize results is to extend the exhalation relative to the inhalation, which activates the parasympathetic nervous system and amplifies the relaxation effect over the entire body within just a few cycles. A common mistake is breathing into the chest rather than the belly, which keeps the nervous system in a more activated state and significantly reduces the benefit of the practice from the very first session. Another mistake is to force the breath, creating pressure and unnecessary tension in the neck. The breath should remain gentle, paced, and effortless from start to finish. For beginners, 2 to 3 sets of 1 to 2 minutes are usually enough to start. For more advanced practitioners, daily sessions of 5 to 10 minutes, ideally practiced before sleep, are usually enough for significant benefit over time as the system learns to settle on its own. Contraindications. People with severe respiratory conditions such as unstable asthma or active pulmonary disease should seek professional guidance before practicing breath retention techniques. And the same recommendation applies to individuals with cardiovascular conditions that affect resting pressure regulation. As an accessible alternative, simply placing the hands gently over the lower ribs and breathing slowly into them provides a very similar stimulus without requiring any specific posture or equipment, making this practice available to virtually anyone willing to set aside a few minutes each day. If you enjoyed this and want to see the 7 daily movements used by older adults in Japan to stay independent past the age of 90, we have a video appearing on screen right now showing each one of them in detail. It is important knowledge for anyone who wants to keep moving freely well into later life, so make sure you check it out. Thank you for watching all the way through, and may God bless you, my